Hello and welcome to ThePrint. My name is Soumya Pillai and today we are in Delhi's Holy Family Hospital, and in this video we are going to be telling you about cochlear implants, the technology that is being used in India in the current period, and how early intervention of implants can help children under the age of 5 to develop hearing and speech abilities in an advanced way. We will be talking to doctors and some of the families to see how these interventions help. Cochlear implants are small electronic devices which can help people with hearing and speech impairments understand sounds. These implants use a sound processor, a wearable device fixed behind the ear. The processor records sounds and sends it as signals to the receiver that has been surgically fit under the skin behind the patient's ear. This receiver sends signals to electrodes, activating the person's cochlear nerve and sending these further to the brain. The brain then hears these signals as sounds. How the technology for implants and early identification has improved. If you could just tell me a little bit more about it.
Like with the advent of we started a newborn screening. So we are able to catch the hearing deficit kids at an early age. Right now, we have started implants even in a age group of 6-month-old child. But in this hospital, youngest child which we have done is a 1 year. And if we do early intervention, the development of the child becomes normal, near normal. Child, if we do an implant by 2.5 years, majority of the children, if they don't have any other abnormality, like a neurological, they go to a normal school, which is a very commendable thing. And if we delay the surgeries, then their development is delayed, but still they are able to achieve normal life. Basically, what happened before these implants were there, deaf and mute children, there was only a sign language with which they can communicate. So it was not only a developmental handicap for the children, it was a social handicap also for the kids as well as their families. And if a child gets a normal education, child will be more productive towards the country.
So, how important is it to detect this impairment early and have interventions at an earlier stage?
If we detect it early, we rehabilitate him early. And if our child is rehabilitated early, then he will be living a normal life. So he'll be more productive once he becomes a youngster. We have kids who have undergone implants way back in 2004, and there are 2-3 kids I know who have started their own enterprises. They finished their schooling and graduation, and they have.
So, if you could also give a comparison between the technology that's available in India, is it at par with the Western world
It's
right now?
absolutely at par with any developed country.
And the kind of programs that India is running and certain hospitals are running, if you could just tell us a little bit about the cost factor and the cost benefit analysis.
Like the newborn screening, it costs hardly 250 to 300 rupees, and in a corporate, slightly more. But it's worth it. If you detect a newborn with a hearing loss and you start early management, that pays for it.
And so, what is the kind of assistance that we are providing in the hospital for economically weaker sections so that they can also avail the
Right
benefits?
now, the implant surgeries which we are doing, there's a program ADIP that is for disabled persons. Not only hearing, all disabilities they cover. And one of the part of the ADIP is a hearing, where the government ADIP provides us with the cochlear implant and surgical cost as well as the rehabilitation cost of a speech therapy of the child for 1 year to 2 years. So parents, they don't have to spend a penny, but this is limited to below poverty line patients. Rest, few of them, we try for a CSR funding for. Nowadays, few governments have also started funding, like UP, Haryana, Punjab. Punjab has now stopped. Uh, but again, they fund in their states. Suppose a UP resident wants to get a surgery done in Delhi, he'll not be provided with the funds. He'll be provided with the funds if a center in UP is.
Specialists in India say that the advancements in the field, including early detection of impairments in newborns, surgical implants, and follow up speech therapies, are helping hundreds of children every year.
वेरी गुड मैम, कितने टाइम में आपको पता चला कि बच्चे ढंग से सुन नहीं पा रहे हैं?
मैम वो जब वो 3-4 महीने का था सब, 4-5 महीने का था सब, जैसे वो बुलाओ कि बाबू ये देखो वो ये कोई चीज़ गिर रहा था, ये पलट के नहीं दिख रहा था सब, तब हम सोचे कि चलो दिखा लेते हैं डॉक्टर से।
तो आप लोग सीधा होली फैमिली लेके आए थे या इससे पहले कहीं और भी?
नहीं, इससे पहले मैं नोएडा में दिखाई थी 24 में, SI जो है वहाँ मैं दिखाई थी।
तो वहाँ पे डॉक्टर्स ने क्या कहा था आपसे?
वो दिखा था, फिर उसने भी बोला कि वो आप मशीन लगाने के लिए, और वो बोला कि उसने रेफ़र किया एम्स के लिए।
तो अभी जब ट्रीटमेंट आप लोगों ने शुरू किया तो किस तरीके से सर्जरी हुई, इम्प्लांट हुआ, थोड़ा बताएंगे कि किस तरीके का प्रोसेस रहा है आप लोगों के लिए?
मैम मुझे डॉक्टर ने वहाँ भेजा तो फिर मेरा बड़ा वाला लड़का भी वो नहीं बोलता है, वो भी 11-12 साल का है, तो मैं वो सर से मैं स्पीच करवाती थी ना, भूपेंद्र सर से, तो वो सर मैं सर से बोली कि सर मेरा छोटा वाला लड़का भी नहीं सुनाई देता है उसको, तो सर बोले कि कोई बात नहीं है, हो जाएगा। तो मैं सर से ही बोली थी, सर बोले कि कोई बात नहीं, आप आ जाना होली फैमिली में, वही हमको एड्रेस दिए थे। फिर मैं यहाँ आ गई, फिर यहीं से सर मिले थे और मैं उनसे भी बोली थी, और फिर यहाँ आए थे, फिर यहीं से जो भी हुआ टेस्ट हुआ, फिर उसके बाद से इम्प्लांट हुआ।
हम आपको किसी तरीके का डर था या कुछ हिचकिचाहट थी कि सर्जरी होना है, बच्चों में काफ़ी छोटे थे उस टाइम पे, तो कुछ इस तरीके का कुछ आपको?
वो डर था, मगर सर से बात होता, सर बोले कि ऐसे कोई बात नहीं है। सर के बात पे वो हमको भरोसा था, सर जो कहते थे वो हमें सही लगता था, सर जो बात किए तो हमको अच्छा लगा, फिर हम सर की बात मान के हम भी करवा लिए बच्चों का सर्जरी।
तो मैम तब से लेके अब तक कितना इम्प्रूवमेंट है बच्चों में, और अभी बात कर लेते हैं, समझ लेते हैं क्या बोल रहे हैं?
जी अभी तो बात कर लेते हैं सब, पढ़ाई भी कर लेते हैं सब, बोल भी लेते हैं सब, खाना भी भूख लगे तो मांग लेते हैं, जैसे कि दाल चावल दे दो, पानी दे दो, मम्मी पापा बोल लेते हैं सब।
हम थोड़ा बताएंगे क्योंकि जैसे आपके तो दोनों बच्चों का हुआ है सर्जरी, कुछ माँ बाप को थोड़ा सा टेंशन रहता है कि सर्जरी है किस तरीके से होगा। अगर आपको बाकी पेरेंट्स को थोड़ी सी अगर कुछ एडवाइस देनी हो कि किस तरीके से जल्दी पकड़ पाएँ, तो उसका थोड़ा बताएंगे कि किस तरीके से माँ बाप थोड़ा ध्यान रख सकते हैं कि क्या क्या ऐसे पहले सिम्टम्स है जो बच्चे शो करते हैं जो जल्दी मम्मी पापा पकड़ सकते हैं?
देखिए, अगर हम मान ली बच्चे सोया है, चाहे बच्चा खेल रहा है, अगर हम कोई चीज़ गिर गई या हम बच्चे को आवाज़ लगा रहे हैं, अगर बच्चा नहीं अगर ध्यान दिया तो हम तो समझते हैं कि बच्चा को सुनाई नहीं दिया है, तभी तो हम कहेंगे कि हाँ बच्चा को सुनाई नहीं दे रहा है।
तो ऐसी चीज़ें हैं जो पेरेंट्स जल्दी मतलब कि ध्यान
दे ही देगा। मान ली यही बच्चा खेल रहा है, अगर हम इसको आवाज़ लगा दिए कि आ जाओ हसन आ जाओ, अगर हसन ये आवाज़ नहीं सुनेगा, नहीं पलट के देखेगा, तो फिर हम कहेंगे कि इसको सुनाई नहीं दे रहा है।
मैम थोड़ा एक बार बच्चों में दिखा सकते हैं कि इम्प्लांट किस तरीके से लगता है और कुछ परेशानी होती है बच्चों को आगे चल के?
नहीं है तो हमको ये अभी इतना पता नहीं है कि आगे चल के परेशानी होगी, मगर डॉक्टर ये कह रहे थे कि इसमें कोई परेशानी नहीं है, मगर ये है। इधर दिखा बेटा, देखो इधर दिखा, यहाँ हुआ है इसका, ये दिख रही है, यहाँ से यहाँ तक हुआ था, यही है अंदर का जो लगा है, वो जो चिप्स यहाँ लगा है पूरा, यहाँ से यहाँ तक ये हुआ था।
अब हम एक बार लगा के दिखा देंगे?
ऐसे करो, बेटा वैसे करके लग गया।
अच्छा।
The challenge in the efforts of early detection and surgeries is the cost. The procedure of tests, implants, surgery, and subsequent speech therapy costs around 7 to 8 lakhs for parents. While hospitals are assisting economically weaker families in obtaining funding from the government, the process of releasing funding is often delayed and tiresome.
We are with Dr. Sumit Ray. He's the medical director of Holy Family Hospital, and he will be telling us a little bit about how early intervention of cochlear implants can help children, especially under the age of 5, to develop speech and hearing abilities early. Thank you for speaking with us, sir. So, could you first tell us about the program that the hospital is organizing for, especially children from economically weaker sections?
So there is for children who are deaf from childhood. Uh, for them, there is this program which is funded by the central government through ADIP, which is an autonomous body which is funded by the central government. So for children coming from lower socioeconomic backgrounds, there is they fund the implant itself and some part of the surgical costs and the cost for speech therapy that is required post that implant. So we have been active in this program for about 3 years, and we have had 16 children through this program. The the cochlear implant program can be either self-financed by parents or if for the economically weaker sections by the government through the ADIP. So we have had 16 children who are from the economically backward sections who have been funded, and 2 who have self-financed the program. So 18 children in the last 3 years. So it's what you asked about, how early and how we should go about doing this is, it's almost like earlier the better, because internationally about at 6 months cochlear implants have been started, but in our center and across most of India, it is at around 1 year that the initial implants are put, the cochlear implants, and that is based on the fact that they are evaluated for severe hearing disability. So there are 2-3 ways by which these children come to us. One is that for every child born in our hospital, we have a hearing evaluation at birth before they are discharged. So that's one element of it. So that if there is any doubt, then we follow up these children and see if they actually develop hearing disabilities, start to have hearing disabilities. So then we start interacting the parents and trying to convince them about the cochlear implant. Then there are lots of children who come to us, the parents bring them because in our OPDs because they feel that either the child is not speaking, because if they can't hear, they don't develop speech, and or that they are not responding to sound, etc. And the third source is that we get patients from, or children from different cities and towns, from UP, from Delhi, from UP, from Haryana, and Punjab. They come as reference from either doctors, ENT specialists who know that we are a recognized center, or word of mouth, that they know people who have got the implant and that's why they come here. And those are the main sources of how the patients end up coming to our hospital.
I'm taking you to the basics.
Right.
What exactly is a cochlear implant? Right. How does the surgery happen? How invasive is it? And
Right.
is it risky at all?
Right.
If you could just tell us a little bit about
Right.
what the technology is.
Right. So the technology of the equipment itself, the cochlear implant, is a very advanced technology. And basically what it does is that where it is found that children who have profound hearing disability or severe, where the chances of their hearing hearing being supported by just a ear, like a hearing aid, is not possible. That's where the cochlear implants are done. And this is where what they do is they place a sensor under the skin behind, like under the skin and bone behind the ear, and on top of it they place a processor through which the child hears. So right, and there is there's electrodes which go from that hearing aid into the cochlea, which is the hearing site in the ear, and basically triggers and stimulates the cochlea, which in these children is not triggered or stimulated with sound, through receiving the input from the sensor, which is received by the sensor outside, and then that's transmitted to the cochlea through this device. And the implantation is that the electrode is a very fine electrode which has to be put into the cochlea, and the hole that is made is about 0.4 millimeters, through which this electrode is inserted and has to be placed very delicately. The surgical skills required is obviously very high level, and it is done by ENT surgeons who are specifically trained in this. The difficulties are that, one, it is very fine surgery. Second is that the placement of the electrode is very close to what's called the internal carotid artery. So it requires obviously very good skill to do that. Obviously there has to be specialized training and skill to do that. So this is, and then what happens is the child does not hear because the stimulus or the input, the auditory inputs are not being received by the cochlea, right? So by these electrodes basically help the child receive these auditory stimulus, which then gets transmitted from the cochlea to the hearing part of the brain, the part of the brain which controls hearing and understand language. So it's a complex phenomena that, one, you have to hear something and then you have to interpret that, right? So that transmission, and that is why it is important that children get the cochlear implant early, so that their brains are in a position to develop, to understand the language that is not just the sound, but the meaning of the sound that is being received. So if it is too late, usually after 5 to 6 years, sometimes it becomes too late. Yes, some children do well even after a few years after that, but best would be to get it early, and surely by 5 years. And that is why it is important to make parents and understand that the importance of doing this early is that the brain has to understand what is being heard. So it's a complex woe, because even if you hear noise, you may not, even if you hear speech from another person, the child may not make of it as only a sound, a noise, rather than actual understandable speech. That is only possible by two things. One is that the brain starts understanding, and through speech therapy the child is taught to understand what is being said. So all these elements have to fall together. That's why when the implant is put, it is very important to have at least a year of speech therapy. In some cases it may require 18 months to 2 years. So all these elements have to fall in place for the cochlear implant to work. And so for any surgery, and particularly for a little child, whenever you are operating, the slight worry of any surgery is that a little bit of bleeding is possible, the degree of difficulty of the surgery, all those are there, but the balance of the advantages is immense compared to the risks in this surgery particularly, and it completely actually changes the life of the child and the family. It makes a huge difference, and the whole attempt is that these children should be that they don't need to go to special schools for the hearing impaired, that they end up going to usual schools that children go to.
So are children the only beneficiaries of cochlear implants? We were speaking about how it could be beneficial for senior citizens beyond a certain age.
Right.
So what could be the advantages of this technology for somebody at a senior age?
Right. So predominantly most important for children, because their speech, their whole life is ahead of them or not. But for the elderly, those who have a hearing loss which is because of nerve related, not or what we call as conduction defect, in those placing a hearing aid, a cochlear implant, who have profound or severe hearing disability. If you have mild to moderate, a hearing aid will help. But if this is profound, then obviously you need a cochlear implant. So the one is that obviously the person can hear, and they are people who have been used to hearing. Losing that ability is this feels like a major disability. Sometimes children who don't hear, have never heard, may not feel as much as a disability. Feel it is maybe a disability, but the elderly who have heard for 60, 70 years and then they can't hear, it feels like a major disability. The other major problem is if the elderly, they can't hear, then it can actually trigger and precipitate dementia, because their social interactions reduce, their inability to hear makes them back away from social situations, they stop interacting with other people, not listening to inputs. So that also can actually precipitate dementia early. So one of the most modifiable factors, see, dementia can be for multiple reasons. One of the most important modifiable factors for reducing the chances of dementia is that they continue to hear and continue to make sense of what they hear. And the other is obviously visual, like if they continue to see and continue to make sense of what they are seeing. So these are the two important things. So cochlear implants would be useful in that subset of patients, but for that the government does not provide any funding. It has to be self-financed. The government provides funding only for children with this disability who are from a lower socioeconomic background.
So coming to the fact that what happens after an implant is done. So if you could tell us a little bit about how does life after an implant works.
So yeah, obviously the work doesn't stop with the implant, and that is the whole thing, that any cochlear implant program has to have a continuity of care. Without a team in place, which includes a technologist who helps what is called map the hearing of the child, because the frequency and intensity of the noise that the child listens to has to be tighter, because the child has not been hearing anything. From there, if the frequency or the intensity of the sound is very high, they get very restless and irritable, and they can start crying, etc. So it has to be mapped in certain way that they hear softly initially, and then it is built up to near normal hearing, right? So the mapping is done for the first year about 4 times. The levels of intensity and frequency are titrated about 4 times in a year. Some children may need them more frequently, and after that about 2 times in the next year, and usually after that it's not required, but some children may require, right? So they need follow-ups. And along with that, while you are mapping and titrating the level of noise that the child is hearing, you have to have prolonged continuous speech therapy. One is the special speech therapist who helps them, and also the parents' involvement is very important. So that goes on for a year on a regular basis, depending on the needs, anywhere from once to twice a week to more regularly for certain kids, more often rather for certain kids. And the parents also need to understand and learn. Usually the parents are very, very committed, very extremely committed to these things. They make a huge effort, particularly the mothers make a huge effort to do this.
There are certain early signs that parents can pick up, like if your child is not responding to sounds or speech or loud noises. This is a warning sign that your child might need an assessment by a professional doctor. A cochlear implant at an age under 5 can really go on to help your child lead a better life. You were with Soumya Pillai for ThePrint.